Informal peer support is simply when people who share common experiences support each other. This occurs in any place where people naturally congregate. Informal peer support can occur in the home, workplace, service setting, or in the community. In the same way, formalized peer support can happen in any setting. There is no special equipment or a particular building needed to provide peer support. Even outside of peer support, many organizations have learned that much of our work can be done from almost anywhere. One consequence of the COVID-19 pandemic is that it created a large-scale remote work experiment that showed that productive work can happen even without a traditional office building. Yet some organizations still hold on to the belief that peer supporters should work in a centralized clinical or office setting. This preference can be for many reasons. Being in a clinical setting can formalize certified peers as being more professional than their informal peer support counterparts. It can be because it's easier to supervise workers in a centralized location, or simply because it's more convenient. Of course, there are situations where keeping peer supporters in one location makes the most sense for the population they serve, like when a CPS provides support to hospital patients or runs a residential program, for example. However, expanding beyond the office can have particular benefits for peer supporters, who tend to serve individuals who may be excluded or disconnected from traditional services. Many peer support organizations run mobile services in order to reach those who may otherwise be isolated or unable to travel to services. These types of programs show the benefits of letting go of traditional expectations for what a workplace should be. Peer supporters know the importance of meeting someone where they are at, sometimes literally. To reach participants that have been traditionally excluded or are hesitant to go to services, peer specialists know they need to put themselves in places where participants actually are. For those with mobility issues or financial constraints, traveling downtown to see their peer supporter may be a larger barrier than one might expect. Other participants may have genuine reservations against entering a service-type setting because of harmful past experiences. Even if these events had nothing to do with peer support, previous negative interactions can lead to distrust or avoidance and can end up being a psychological barrier to care. Creating a trauma-informed and psychologically safe environment can sometimes include distinguishing itself from clinical settings. Fortunately, peer support often does not need to be in any particular setting. Peer support can happen in homes, parks, on the streets, at recovery events, or anywhere. The success of mobile peer support shows us that this can happen while still adhering to the confidentiality, documentation, and supervision requirements of certified peer specialists. Holding on to the belief that formalized work can only happen in an office or clinical setting limits the potential for peer supporters to reach the most marginalized of communities who would benefit from services. Certified peer specialists can also be limited in their scope when leadership holds on to a narrow definition of what care for mental health should entail. In the medical model, mental health care focuses on the mental health diagnosis and symptoms, believing that other systems such as housing, family, and education are not relevant and should be addressed separately. Those who operate from the recovery model know that mental health recovery is much more than just treating and reducing symptoms. Those who have lived experience also understand that recovery is very hard to achieve when an individual struggles to get their basic needs met. Understanding the impacts of social determinants can explain the connection between individual mental health struggles and other social ills. While mental health challenges can happen to anyone, certain experiences such as housing insecurity, poverty, interactions with the criminal justice system, and substance use correlate with the likelihood of having a mental health challenge. Therefore, peer support doesn't only have to happen in settings that are strictly about mental health. Participants can benefit from receiving peer support in a variety of other service settings. Peer supporters can be applicable and have been successful in a variety of environments. This can include hospitals, emergency rooms, prisons, drop-in centers, sober homes, youth groups, housing services, child welfare agencies, homelessness outreach, drug court or other criminal justice settings, residential settings, street outreach, food banks, employment support, and many more. When organizations fully adopt the recovery model, they begin to understand how interconnected mental health is with other areas of an individual's life goals. Peer support has this potential to serve their participants with these diverse needs. By expanding their horizons of where peer support can be done, supervisors can support their peer supporters at better reaching and supporting their participants.